When we presented the results this year at ASCO GU, we found on the primary analysis that we didn't quite meet statistical significance for progression-free survival. The hazard ratio was 0.71 and the p-value was 0.06. Same thing with metastasis-free survival. For the overall trial, we did not quite meet it. The hazard ratio there was 0.57 and the p-value was 0.05. However, where it got really interesting was in the pre-planned, pre-stratified subgroup analysis. So this is for patients with a PSA greater than 0.5. We saw a very significant benefit to Abiraterone and Apalutamide. So specifically for progression-free survival, we saw that the hazard ratio was 0.5 with a p-value of 0.03. And more importantly, for metastasis-free survival, which is a surrogate for overall survival, we found a huge hazard ratio of 0.32. The p-value, which was two-sided, was 0.02. And the absolute benefit at 3 years was an 18% difference in metastasis-free survival. So that meant that the number needed to treat to prevent one metastasis at just 3 years was barely above 5. So in terms of what this means, I think that the FORMULA-509 regimen, which is basically 6 months of intensified ADT with Abiraterone and Apalutamide, provides a very attractive option for patients who need some kind of intensified therapy beyond the usual 6 months of ADT. And to put this into context, we can think about the Radicals HD trial, which was a hugely important, huge phase 3 trial that came out of England and found that when you compared 24 months of hormones versus 6 months of hormones, which was our control arm also in FORMULA-509, that there was an improvement in metastasis-free survival. But when you kind of compare the hazard ratios, meaning compare the benefits seen in the FORMULA-509 trial of intensifying 6 months of antideprivation versus the hazard ratio in the Radicals HD trial, where you lengthen the ADT to 24 months, our hazard ratios actually came out favorably. So for the overall trial, the hazard ratio for the Radicals HD 24 months of ADT was 0.77, and our overall hazard ratio for MFS was 0.57. And when you looked at the patients with a PSA greater than 0.5, the Radicals HD hazard ratio was 0.67, and ours was 0.32. Now, of course, you cannot compare trials directly, but just to give people a sense of the magnitude of the benefits, certainly the magnitude of our benefit seems at least similar to and numerically greater than what was seen in the Radicals HD trial. So, in the future, this is going to be studied further, and I'll talk about that in a second. But what I think it means for now is that for patients who need some kind of intensification beyond 6 months of ADT in the salvage setting with the rising PSA getting salvage radiation, I think that 6 months plus Abiraterone and Apalutamide is a very attractive alternative to needing to lengthen the duration all the way to 24 months, which carries now 2 years worth of side effects.